had a lump come up my neck, which was identified by the wife. But I tend to have lumps, I've got one there in my arm.
At the beginning it was quite small, and then a few months later it just seemed to be getting bigger. So I persuaded him to go to the doctors.
I went to the doctor because I had pain in my right breast, and she said that she thought I was suffering from menopausal symptoms, but I needed to get checked out at the hospital. And I went to the hospital for a mammogram, and I had a lump in my left breast. And yeah, it just kind of takes your breath away.
There was about a 5p piece size of matter on the back of my tongue, which appeared to be cancerous. That's a real moment in time when someone tells you that.
Yeah, it's so raw, it's so quick. You're now not in control of your own life, your own body. You're not sure what's going to happen next. So the confidence that I had before went.
We did make plans for what was the worst case scenario, and how would we manage it as a couple, how would we talk to his children about it.
Your whole perspective on life just changes overnight. As soon as you get that diagnosis, like I said, my legs went, you start thinking about death.
Now I question things I would never have questioned. I feel less confident about how I look as a person. I feel different.
Yeah, it's life-changing.
You're thinking all the problems you're creating for your family and your friends, and your close family on station as well, And there was days where you just thought, I don't want to wake up. Not good times.
Many people think that once their treatment's over and done with, that it's get on with normal life, but actually they're still living with the fact that they've had this huge life-threatening illness.
I'm conscious that it could come back. I'm on medication for at least 5 years to kind of prevent it coming back.
As a professional to tell you, definitively we can't say, but I don't smoke. I've never smoked. I've never been a regular big drinker, and there's lots of risks that you can have as a member of the public, but I simply don't have those. I just believe that I was working in an environment that didn't do me any good.
We don't know if the cancer's caused by working in the fire service or some other factor, but breast cancer's not in my family. I'm not 50 yet. I'm a healthy person. The first watch that I worked on, 3 of my colleagues from that watch have died of cancer in their 50s. Like me, we don't know why they got that cancer, but it's, you can't help but draw some parallels, and they were young and left devastation behind for their families. So yeah.
There was somebody on Sid's watch previously that had the same cancer.
It does go through your mind, have I brought this into my house and contaminate them?
Friends, family, partners, to know that I potentially might have taken that home with me, don't make me feel good, it's not smart. If 19-year-old Kerry could think what 48-year-old Kerry's gone through, then I would definitely be thinking more carefully about what I can do to protect myself.
You do get drawn into that work environment, and you think that that's all that matters, but you have got a life outside of the fire service. But to make the most of that, you need to be alive.
Worldwide studies, especially in Canada and the US, show that 67% of line-of-duty firefighters die from cancer. Yet, if you go to Europe, and specifically in the UK, there are almost non-existing studies in that subject. The main aim of the project we do is to look at contamination issues and approaches and decontamination methods. The project was commissioned by the Fire Brigades Union. That led to the creation of the Firefighters Cancer and Disease Registry. The main aim is to identify link between firefighters' exposure to the occupational cancer. If we do not have firefighters participating, we will be not able to provide preventative health screening, support educational information that will actually be directly related to UK firefighters' health. Fire produces two different groups of fire effluents. Acute toxicants, which would have immediate effect and single exposure, something like carbon monoxide, hydrogen cyanide. But fire will also produce chronic toxicants. Chronic toxicants is usually low concentrations of toxicants but are produced in every single fire or most of the fires. And the best example would be polycyclic aromatic hydrocarbons. That's your polycyclic aromatic hydrocarbons. So if you look at the soot, as you can see, there are tiny particulates just absorbed on the walls. So you can imagine how easy that would be to inhale. And the other intake of those toxins will be through the dermal intake, which is through the skin absorption. So if you're sweating, your temperature body increase, anything what you've got on the surface, the dermal intake or absorption through the skin will be increased. Some of the studies suggested that if you've got body temperature increase of 5 degrees, there is dermal intake increased by 400%. Once you've got those toxins in a system, some of them will be eliminated, but some of them, because of the big structure that they've got, chemical structure that they have, they will be stored in fat and tissue. And within the years, when you build up all of them, they will deliver and lead to a cancer. The first really dominant cancer is the skin cancer, which indicates that skin is not necessarily protected, and therefore most of the toxicants are taken through the dermal intake. My main message to firefighters would be, please be aware of contaminants. Keep in mind that even if you cannot see them, they will be still there during and few hours after the fire.
Your PPE should be cleaned regularly and after you've attended a fire. If you are cleaning your kit, always cover exposed skin, use disposable gloves and wear a face mask. Even if your firefighting gloves are clean, never store them in boots or helmets. Make sure your kit is clean before carrying it. If you do have to touch dirty kit, make sure you use disposable gloves. Wear BA whenever you are firefighting, even during salvage and turning over and damping down. Never put your BA on too late and never take it off early, unless you need to protect yourself from heat or strain. After you attend a fire, change into a clean t-shirt before you get in the appliance. Facilities need to be provided to protect your dignity. Seal any clothing or PPE exposed to fire in an airtight bag or box before you take it into the appliance. Back at the station, shower within an hour of attending a fire. Use soap and scrub your skin and wash and dry your hair. If you need to go straight from a fire to another incident, use wipes or soap and water to clean your hands, forearms, neck and face. Only cook, eat or drink at the station once you and your clothes are clean. Don't even get water from clean zones such as the mess until you've washed and changed. Check your kit for visible damage every shift, and your brigade should be getting someone who is trained to find damage to check it regularly, at least every 3 months. Shower and change your clothes before you drive home. Avoid carrying clothes that have been exposed to fire in your car. If for any reason you do need to, seal them in an airtight bag or box. Remember to wipe down your steering wheel, handles and dashboard often. Regularly wipe down your phone, wallet and other objects you carry to work, using one wipe for each item. If you couldn't shower and change at the station after the last fire you attended, get straight in the shower once you get home. Make sure you don't hug, kiss or touch anyone until you've washed and changed. Put bags that you take to the station through the wash regularly. Wash the bags alone and run the rinse and spin setting afterwards. Facilities should be made available to wash work clothes at work away from home. Not all fire and rescue services have this in place yet. If you have taken home work clothes that have been near a fire, tip them directly into the washing machine from the bag or box they should be sealed in. Don't touch these clothes with bare hands, and don't mix them with other laundry or leave them lying out. After you've washed the clothes, run the rinse and spin cycle to clean the machine.
When I was doing the cancer survey that the Fire Brigades Union sent to all existing firefighters who'd left, either retired or who had left, I was filling it out and it was asking me questions about what I had done when I was a firefighter. And, you know, as I was answering them, I was thinking, crikey, you know, I'd go to a fire and unless it was a really big fire where I was really hot and sweaty, I would still jump back in the machine with all my tunic on, with my smoke hood on. You wouldn't go back to the station and necessarily have a shower because, you know, it wasn't very often that you take the fire engine off the run because you were dirty. We'd get out of a fire and we would eat and we would drink with, you know, soot and smoke and all sorts all over our hands, our faces, my hair. And I was answering these questions and thinking, oh, you know, there's something that perhaps I could have done differently.
You may not be washing your hands today, but in 10, 15 years' time, you may well have that cancer. Now I'm all over it like a rash. You know, you've got to have that PPE. The PPE is provided, and if it's provided, then we've got to be using it. You've got to look after yourselves.
When you're young, you don't think these things are going to ever affect you. You know, young firefighter, done my training, fit as, going to be able to do loads of things.
It's not just that big red glowy thing inside the house that's going to kill you. It's the stuff that's coming with it. You know, I can find maybe that firefighters see these sort of like little bit of a grey area, whereas they'll kick back against it. But really, they shouldn't be. They should be taking it on board and getting it right, really, for themselves and their families.